A cough, a fever, a virus no one had heard of. And within months, the world as we knew it had changed forever. COVID-19 was not just a health crisis. It was a mirror showing us just how underprepared, unequal, and unaware we really were.
Today, as a new variant resurfaces and the true death toll finally emerges, we ask, what really happened? What tamed this invisible killer? And are we ready for the next one?
SARS-CoV-2, short for Severe Acute Respiratory Syndrome Coronavirus 2, this was a microscopic enemy behind the COVID-19 pandemic. It attacked with stealth and speed. Once inhaled, its spike proteins locked on to the ACE2 receptors in our respiratory tract, allowing it to inject its RNA into our cells, hijack them, and replicate rapidly. The result? Fever, fatigue, cough, and for some, acute respiratory distress, cytokine storms, multi-organ failure, and death. It was new, it was unpredictable, and we had no natural immunity.
Despite repeated warnings of a coming pandemic, the world was shockingly underprepared. Testing was slow, masks were scarce, hospitals were overwhelmed, leaders hesitated, some denied, while others delayed.
From the wealthiest nations to the smallest islands, the virus exposed the fragility of our global health infrastructure. It wasn't just a health failure. It was a failure of governance, of investment, and above all, of imagination. We were told millions died, but now we know that is only part of the truth. In many countries, death numbers were intentionally downplayed or woefully underestimated. Why? Lack of testing, poor reporting systems, political pressure, and fear of panic.
In India, many studies and investigative reports suggest that the actual numbers were way higher, 3, 5, or even more times the official figures, with rural areas and undercounted cremations skewing the numbers significantly.
Today, global health agencies estimate the true global death toll could exceed 20 million. It's a number that should haunt us, not just because of its size, but because we let it happen silently. The virus was ruthless, but so was the recklessness of some in power. Across the globe, certain leaders downplayed the virus, mocked masks and promoted pseudoscience, even as their citizens died in record numbers. While doctors pleaded for ventilators, politicians rallied for votes. And while scientists warned of second waves, some leaders promised it would all go away like magic. In the United States, in Brazil, and parts of Europe and Asia, evidence was ignored. Whistleblowers were silenced and misinformation was weaponized. This wasn't just mismanagement, it was moral failure. Apathy dressed up as confidence, ignorance passed off as defiance. And behind every misguided press conference or unscientific policy were lives lost unnecessarily. The pandemic demanded leadership. What many got instead was politics. As fear spread, so did science. Doctors fought back with whatever they had: remdesivir, dexamethasone, monoclonal antibodies, oxygen therapy, prone positioning, blood thinners. Each method improved outcomes little by little. Treatment helped some, but the only way out was prevention. In record time, scientists achieved the impossible. Just 11 months after the virus's discovery, the first mRNA vaccines by Pfizer-BioNTech and Moderna received emergency use approval. A global vaccination campaign began, The mRNA tech taught our cells to recognize the spike protein, arming our immune system before the virus could strike. AstraZeneca, Johnson & Johnson, and inactivated vaccines like Covaxin, Sinovac, and Sinopharm followed. These vaccines did not just prevent infection, they saved millions of lives by reducing severity and hospitalizations. But again, the pandemic revealed our moral fault lines. Rich countries hoarded doses. Poorer nations waited in vain. Even COVAX, the global sharing initiative, struggled. Vaccine inequity became the new phase of injustice. Just when it seemed we had turned a corner, the virus changed. From Alpha to Delta to Omicron, and now a new variant in 2025. We're reminded complacency is COVID's greatest ally.
Some countries are reinstating mask mandates. Others are watching ICU admissions climb. Yes, we are better equipped, but the virus is not done with us yet.
So, what did COVID-19 teach us? That viruses respect no borders, that public health is national security, that science saves lives. But will we remember these lessons, or wait again for the next crisis to remind us?
COVID-19 shattered lives, but it united science, accelerated innovation, and brought humanity face to face with its vulnerabilities.
We adapted, we endured, and in many ways, we grew. The world is changed forever, but whether we are wiser is a choice.
If this informed you, moved you, or made you pause and think, please do like and share the video and subscribe to the channel. Because understanding what happened is the only way to be prepared for what could come next. Stay aware, stay human, stay safe.